Tianeptine is a drug used in many European, Asian, and South American countries for depression, anxiety, even IBS. Its brand names are Coaxil or Stablon. In the US, it's usually sold as pills or as a powder under different names like Zaza, Tiana, TD, or Pegasus. It's commonly called gas station heroin because of its opioid-like effects. A lot of people use it to self-treat chronic pain, depression, anxiety, or even opioid addiction and withdrawal. However, it definitely has some health risks. There have been cases of overdose and death in medical journals and in calls to poison control centers. The FDA actually put out an advisory warning people about its risks. But in a sort of legal loophole, vendors avoid FDA regulation by selling tianeptine as a dietary supplement, which is not regulated by the FDA. So let's talk about how it works. Tianeptine is an atypical tricyclic antidepressant. So its molecular structure is most similar to other psych meds like amitriptyline, nortriptyline, and doxepin. But unlike most antidepressants, tianeptine seems to have minor effects on glutamate, norepinephrine, dopamine, and serotonin. Studies have shown that it primarily works by activating new opioid receptors the way heroin, oxycodone, and fentanyl do. This is why people who use opioids may use tianeptine to help relieve opioid withdrawal symptoms. But tianeptine use can also lead to tolerance, withdrawal, addiction, and of course, overdose and death. When someone buys tianeptine online at a head shop or a gas station, they're taking a gamble because they can't know for sure how much of the drug they're actually getting. So like I said before, this means there's a risk of overdose. So are you taking tianeptine? Are you interested in stopping it? If you want to get off tianeptine, since it leads to physical dependence for your opioid receptors, medications for opioid use disorder like methadone or buprenorphine can help. You can find opioid treatment programs near you at findtreatment.gov. Here at Bicycle Health, we'd also be very happy to help you in starting your recovery journey. Also, keep in mind that even though it appears to be minor, tianeptine still has some mild effects on serotonin and dopamine, so you might experience a withdrawal more similar to antidepressant withdrawal that won't be addressed by opioid addiction medications like Suboxone. If you're thinking of stopping on your own without professional help, definitely consider tapering instead of stopping cold turkey. And maybe you're not interested in stopping. Maybe you don't feel ready to seek treatment. That's okay. There's no judgment here. Here are some tips for lowering some of the risks that come with using tianeptine. Remember, tianeptine is unregulated, so you can't be certain what dose you're actually getting. So just be as safe and cautious as possible. Remember, the prescribed dose in other countries is typically around 12.5 milligrams, 12.5 milligrams, 3 times a day, which is a total of 37.5 milligrams daily. Treat it like an opioid. So avoid or minimize combining it with other downers, aka depressants like alcohol, other opioids, benzos. Because tianeptine is pretty rapid onset and almost 100% of it is absorbed when you take it orally, injecting or snorting probably won't increase its effect. If you're taking other antidepressant medications, definitely be careful because some of those medications increase serotonin. So combined with tianeptine serotonin effects, there's a risk of something called serotonin syndrome. And finally, as a general harm reduction measure, try not to use alone and have naloxone, aka Narcan, on hand in case of an overdose.